Thank you, Mr. Speaker. Mr. Speaker, I rise this morning to provide my honorable colleagues with an overview of the Bermuda Hospitals Board's 2009-2010 annual reports, which were recently released. Hard copies of the reports are available from the Bermuda Hospitals Board, and electronic versions can be viewed on the board's website in the news and media section at www.bermudahospitals.com. The annual reports include a commentary on the improvements and efficiencies made by the BHB over the last 2 fiscal years. I would like to note that the audited financial statements for these years were tabled and debated in the House last year. The BHB's mandated reporting of audited financial statements is currently up to date. Mr. Speaker, even a quick review of these reports shows that these have been exciting and challenging years for the Bermuda Hospitals Board. Over the last 2 years, the procurement process for the new hospital facility has been undertaken, as well as the successful construction and opening on time and budget of the Lamfogo Urgent Care Center. Also during this time, Bermuda's residents have experienced improved access to medical specialists through relationships with partners such as the Leahy Clinic, Dana-Farber Cancer Institute, Massachusetts General, and Johns Hopkins. These partnerships are important as they help to raise the quality of care in Bermuda and also help to control health care costs incurred by overseas travel. In the fiscal year ending 2009, clinical quality was improved with the introduction of the Hospitalist program, which triggered an almost immediate 20% increase in patient satisfaction with physicians. The level of inpatient satisfaction with the quality of care provided by doctors has continued to increase and currently stands at almost 95%. Mr. Speaker, new services were provided at child and adolescent services, including a special camp for children who would normally be excluded from regular summer camps due to their diagnosis. The BHB's substance abuse services also started evening groups for anger management and a women's group to provide support outside of working hours. Yes. In the fiscal year ending 2010, while work continued to advance the new hospital building procurement process, phased improvements were undertaken in the existing facilities. These included revitalizing the wards and emergency entrance and establishing a backup data center at MWI. With so much medical equipment now relying on IT systems, it was extremely important for patient safety to ensure that equipment did not fail. A new system in emergency helped improve care and patient data, and a picture communication systems, also known as PACS, went live, making the hospital's X-ray, MRI, CT, and nuclear medicine diagnostic services entirely digital. Other achievements in 2010 included pathology. BHB's laboratory service was accredited by the Joint Commission International. BHB's Diabetic Center was ranked as the leading site in the International Origin Trial, outcome also known as the outcome reduction with initial Clarigen intervention. 2 new group homes opened for the learning disabled, further reducing the number of service users who had to live in an institutional setting. Services were improved for the autistic and the ADHD children and adolescents. A memorandum of understanding was agreed between MWI and the Department of Corrections to better manage offenders who have mental health problems. New beds were introduced at King Edward that reduced the potential for ulcers. And hourly rounding was introduced, ensuring patients at King Edward are seen every hour by a nurse and asked about their comfort, whether they are in pain and if they need to visit the bathroom. The goal is to improve the patient experience and reduce the potential for falls with patients trying to reach the bathroom on their own. Mr. Speaker, I would like to ask my honorable colleagues to join with me in thanking the staff, the management, the board of the Bermuda Hospitals Board for their tireless work in improving services to meet the needs of our Bermudian people. We expect a premier health service in Bermuda, and the BHB's 1,800 staff remain focused and dedicated in providing it 7 days a week, 24 hours a day, 365 days a year. They have shouldered the additional work of planning and preparing operations for the new hospital facility while keeping a close eye on quality improvement, revitalizing existing facilities, improving existing services, and updating technology. Thank you, Mr. Speaker.